For those of you who don't know, I'm Cindy Miles. I'm the president of the APTA Academy of Pediatric Physical Therapy, and this is our first town hall. So we definitely would like to welcome all members, because I was going to say members and non-members, but and everyone else participating in this call. So on behalf of the APTA Academy of Pediatric Physical Therapy, we certainly appreciate you joining us this evening. And again, we all apologize for what happened. Who knew? I certainly hope that this finds you all safe and well in this rapidly changing environment. None of us could have ever imagined or predicted how fast and to what extent our world will change, especially in the realm that we have. We will find ourselves in one of the most unprecedented and extreme challenges that anyone in our lifetime has ever experienced. It's difficult to watch all this happening across the globe and feel so helpless. In the coming weeks, we're going to forge ahead into the unknown. The Academy leadership has planned a series of town halls, and they'll be hosted by our 7 special interest groups. And our goal is for you all to connect with your leaders and individuals in various practices areas throughout the country. Part of the slides will have those meetings on there, but it is on our website as well under news. So I've been so thankful to be a part of this wonderful community within our association, the Academy, and all the individuals I've met and engaged with, not just during this time, but certainly over the years throughout my career. The comfort I've experienced over the past few weeks has been remarkable because we are immersed in this 24/7 in this pure chaos. But I think we should focus on what we can accomplish that's in front of us. It should be a priority. We've received many questions across all practice arenas. Telehealth has quickly become the #1 practice arena of choice across all areas. APTA has been in step with us from the beginning, responding immediately to member concerns, 7 days of the week. We can call on them anytime and we will get an email immediately, and they're responsive to anything that we're asking them or that members are asking for us. Our newly elected advocacy and practice directors were quickly thrown into the fire, along with the Academy special interest groups, our executive director, Cindy Sliwa, and our entire board. They've all been very busy, and they've been collaborating consistently with APTA to create documents and resources that are available for you onto our website. You'll see if you go to our website, there's a banner that says COVID-19. You can click onto that banner and you'll find information directly on there related to the resources that you have available. You can find them both on APTA and APTA Pediatrics site. The Academy website certainly has a wealth of information right now. And APTA does as well. There's a one-stop page. So what I have on the email for you, there's 2 different websites, 2 different links that I have from APTA, their page. One is the COVID-19 resources for the physical therapy profession, and then one is the APTA components. A lot of the components have stepped up. We're sharing information on a consistent basis. We have a council of the president's meeting in a few evenings, and we're all going to figure out ways that we can share resources amongst all the 18 academies and sections. But in the meantime, APTA has posted a great deal under that link as well. So APTA themselves, from the information that they're receiving and the calls that they get, they've identified 3 issues that our members that have been emerged in since the beginning, since we started to transition, and also since the social distancing. What they said to us is that we're pretty much the front line. So if we're getting the calls, then they're getting them secondary, but we seem to be on the same page with them. If I check in with our advocacy and our practice directors, the 3 things that seem to be most on members' minds are telehealth, the impact that it has had on our PT and our PT assistant, our education programs, and they're looking for guidance from the accreditation side, specifically CAPD, and also the impact on the care and practice management throughout all of our practices areas. So the forums, we have a new, if you've been onto the website, you'll notice that they've been working really hard, our leadership team, along with Jason and Cindy Sliwa, to update our website, and we're quite proud of it. There's a lot of interaction for you. I'll remember the old listserv. We now have forums. So these forums are going to be a way for y'all to connect. You'll see that right now there's one that has to do with APTA Pulse. Let me see if I can make this bigger. APTA practice. We also have one under PEDS academic and clinical education. We have under the federal and state advocacy issues, and then the pediatric specialist examination. So click on there, interact with the other members, have the conversations going. I think if more people are aware of this, then we'll have more people being able to connect with each other And I think that will certainly help, because connecting at this point of our social isolation and our social distancing will be a key to keeping us all moving forward. In addition, the private practice section of the APTA, they've opened their site to members and non-members, and there's a wealth of information and resources on that site as well. So even if you're not in private practice, no matter what arena you're practicing in, please go to that website, because you'll be able to find a lot of information, lots of documents, also in addition to lots of webinars related to telehealth, both on APTA's website, private practice website, and ours as well. I think we need to remember, step back. We are all in this together. I urge all of us to focus on what we know as opposed to what we do not know. We have to focus on what we can do as opposed to what we cannot do. We have to look for the facts that are in front of us, and we certainly have to ignore the fear. I know that that's difficult during this time, because there's so many unknowns. It's nothing that we've ever experienced, and we all know that. We all feel like we're in a war zone, at least I know I do. So let's maybe not let that fear take over, and let's look at what we know. We are certainly living in uncertainty and grave concern, but we now have the opportunity to forge ahead, and we'll take each other together. We'll become renewed, and we'll be better together. If we can focus and be confident on the children that we serve and the families that we serve and the members, your leadership is going to be focusing on that. You elected us to represent you, and we will do that the best we can. Also, you have legislators, and we have a great advocacy team, not just within our academy. You have it within the APTA as well, and each of your states. On the link, you'll see that we've put up there links for you to be able to reach out to advocacy individuals and figure out what you need to do, what you're having trouble with. And also, I encourage you to consistently reach out to the legislators in your state. APTA has been sending various links out to link to your legislators to talk to them about telehealth, and opening that up to all insurance companies and and to Medicare as well. I know Medicare doesn't affect us, but if Medicare turns it around, we know that it will help to turn around other insurances, and that'll help each of the individuals throughout the country. In our particular area of the country here, New Jersey's governor has stepped up, and he said that all insurance companies must accept telehealth, and they must the same rate that they were paying for the commercial insurance and for the in-clinic visits. Our state, a week and a half ago, shut down early intervention face-to-face. And by Friday afternoon, the governor opened up our Practice Act to allow OT, PTs, and speech to be able to provide telehealth, or we're calling it teleintervention from Pennsylvania, with our children 0 to 3. So we're scrambling to do that, and a lot of people have jumped onto that wagon, and they're excited for it. And what that does is just allow our individuals to continue to be seen. A lot of my colleagues that are in private practice, one of them is in Washington, in Kirkland, and her practice was in the epicenter of the beginning of all this several weeks ago. So she has been doing telehealth for almost a month now, and her staff is embracing it. So I think I look forward to this, because I think at the end, this is going to be an excellent resource that we all have to move our practices forward. So there'll be automatic alerts if you set yourself up in APTA. If you go to their advocacy app, that will be on the slides that you have through there. But as I said, don't forget to contact your legislator about any issues that you're having, if it's school-based, early intervention, your private practice. They want to hear from you. I remember several years ago, probably 10 now, we had our PT PAC meeting out in San Diego, and there was a senator that was speaking to us, and back then the newspaper was more involved than the internet or social media. But he told all of us, if you come to meet me in my office, and if you complain or not complain, when you leave there, I'm going to say that you said something positive. I'll find a positive way to twist what you told me. But if you put a letter to the editor, everybody's going to see that. My constituents will see that, and they'll know I will have to act on that. So we have social media now. Use that to your advantage to get our legislators to respond for all the children and the families that we serve. So I'm confident that each of you will continue to give of yourself. We'll all when we come out on the other side of this, and we'll come out on the other side of this better together, for sure. I was at the Graham sessions this past January. If you're not familiar with the Graham sessions, they tell us what happens at the Graham sessions, stays at the Graham sessions. One of the things that we talked about was social determinants, and whether or not that we should be involved as physical therapists, if that should be our focus. And they had a panel, so one person was for it, one person was against it. And I stood up and gave my view, and this is my view on this, especially during this time that we're facing in front of us. The vision of the APTA Pediatrics is to optimize movement for lifelong meaningful participation of children. Our Academy mission and core values challenge us to advocate, educate, elevate, and lead. A healthy society starts prior to birth, and movement begins with pediatric therapists, and that's who we are. We have the opportunity to optimize movement right from the beginning. We're in NICUs, we're in schools, hospitals, outpatient, inpatient, private practice, home health. The majority of our pediatric practitioners believe in family-centered care, whatever that family makeup may look like. Individual physical therapists debate if we as a profession should take a stance on social determinants. In fact, when the APTA has taken a stance, we lost members. I believe pediatric therapists across this country are going to be faced with social determinants at all levels of practice. When we come out of this, we have been before, but we're going to be coming out to something we're totally unfamiliar with. We provide early intervention, which we all know in 50 states is generally in the home. We're acutely aware of gun violence, drugs, child abuse, children in foster care that may be returned to unsafe environments, children removed from their families at the border. If the child was fortunate enough to have been removed from the border or the cage that our government placed them into, how can we optimize movement in any of these environments? How do we stand at the grocery store and make sure to buy cage-free organic eggs when we cannot ensure cage-free children? Do we value children or chickens more than our children? I am very thankful that APTA and our academy took a stance along with the American Academy of Pediatrics. There's no question this pandemic will challenge all of us with new social determinants we can't even imagine at this time. The question has been, do we have evidence or do we have models of practice that indicate that we should care about social determinants? And I certainly believe that we do. Research indicates that motor components involve a complex process that's influenced by multiple factors, which environment is one of them. Therefore, if I want to influence a child's movement, I need to be aware of all environmental factors that are facilitators or barriers. Research indicates that variability is the hallmark of change, one of the driving forces for emergence of new behaviors. Complexity will allow that infant or child to adapt to that changing environment, which we certainly know is going to happen when we move to the other side of this. It predicts the emergence of new behavior, and we are going to emerge from this crisis in an entirely new landscape. Lack of variability and complexity limits experience and adaptability, and it makes it difficult to select that best strategy. So as we enhance variability and complexity, we promote optimal level of movement variability, which leads us to functional change and allows us to adapt, filter the input, and decide what is most relevant. We need to do that as far as how we're going to respond to this pandemic on the other side. It will allow movement possibilities that are not predictable. It will allow practice possibilities for all of us that are not predictable. We have that evidence. Let's be variable and complex within our association and allow us all to adapt to the new possibilities within this changing environment. Children are our most vulnerable members of our society, especially children with diverse abilities. Now more than ever, we must be cognitive determinants in the aftermath of this pandemic. I urge you all to keep your eyes, your heart, and your thought process open to all possibilities. I believe that that's our responsibility for sure.
We do have some questions, Cindy, if you're.
Yeah, I'm ready for that.
We actually have some people already answering the questions, which is great. The question was, have you heard from families what their preferences are in teleintervention modalities? And also do home visiting, and are we finding families prefer telephone or Facebook modalities versus Zoom, which is more HIPAA compliant, and we are worried about privacy. And Andrew had said in response to that, Andrew Supfin, so far my families prefer Zoom for teleintervention. However, we are encouraging Microsoft Teams for a safer mode of communication. Joan Cheka says, my caseload is primarily adolescent with multiple handicaps, many medically fragile. My treatment is very physically involved. I am stretching my clinical imagination around this challenge. Yeah, I think a lot of people are. Let's see. Most of our families only have a phone and don't want to use these apps, is what one person said. We just saw that what Zoom can do exactly. We are using Microsoft Teams and Google Meet. Zoom is not secure. Families can access these sites via phone. There's now, and I've heard this too, there's a HIPAA compliant version of Zoom. I believe, yes, and can use a phone, iPad, or computer for Thera platform. So that's another platform, Thera platform. I think what I'll end up doing is saving this chat, though we are recording this as well, so we can go back and we will post this so it's viewable for people, and hopefully the chat will be, but I will save the chat so I can collect these together so we can put these in maybe a document for everybody to share. Somebody's using doxy.com for e-visits. GoToMeeting. Video is been told is HIPAA compliant from Caitlin Tierney. VC, oh my gosh, there are a lot of options. Holy bejeebus.
So Jason, I think that we can definitely share resources. I know we initially have some resources on there, but we're continuing to get more, and there are a lot again on that private practice site. There's also an app called so it's DOX. John, correct me if I'm wrong when I spell this, DOXIMITY. John Greenwood had talked to me about this. If you can put that on your telephone, it actually protects your privacy as well. I think that this is one of the things I've been worried about. I know in Pennsylvania when they opened up for allowing us to do tele-intervention, one of the things they have, they haven't eased, I think the misconception is that they eased the guidelines on HIPAA. They haven't done that. They haven't eased the guidelines. What they are saying is they will not sue a hospital over HIPAA violations at this point. But I think we need to be as diligent as we can to protect the privacy of the children that we're treating. So I think as much as we can find some of these, there's free apps that are out there that you wouldn't have to pay for to be able to do this, and allow your families to have those apps as well. So we can protect their privacy when we get to the other. We just, again, like you said, we saw what happened this evening, and we don't want that to happen to our children's information.
Connie Johnson had a really good point. You need to check your State Practice Act too. She said in Virginia, the Practice Act specifies exactly what you must do, including emergency plan and ensuring family technology proficiencies, or et cetera. So check your State Practice Act.
And again, we put a resource on there, and that's fantastic, Connie. Next thing too, also check your malpractice. Make sure that you are covered for telehealth under your malpractice as well. It's easy in these times when things are so grave and we want to jump in and help because that's who we are, but we have to remember to protect the children and ourselves as well, our licensure.
And Cindy Sliwa brought up a very good point. Just because they won't sue a hospital doesn't mean that families can't sue you if there's a privacy breach. Yeah, class action is different. Yeah.
Great point, Cindy, yes.
And Rebecca talked about, make sure you have your consent form in place as well. That's a good point.
Have many of you started to do some telehealth already? I think, Jason, we were going to try and do a poll, but then we pulled back on
that. It sounds like a lot of people have. There's some people that haven't.
Those of you that are doing it, are you enjoying? I see this as really going to be a wonderful platform. We've been looking into this. We just recently had we had information on it at 4-Step. We had a roundtable, an intensive roundtable at our annual conference in November. I look at this as for early intervention for those of you that are living in rural areas that you can't get to children on a weekly basis. You could be seeing them once or twice a month, and then doing the rest on telehealth to really just keep the families engaged. I see this. We talked about it at our clinic that if the brother is ill and they can't make the therapy that day, you can pull in a televisit for the individual as well, especially if they're more acute and especially if they're like post-op. I think it's going to be a major advantage for all of us.
If anybody would like to talk about if they have a really good telehealth experience that they want to talk about, in the chat box, just say that you'd like to, and I'll pull you up and unmute you. Let's see. I've had several families using cell phones and have found. Let's see. We're starting.
Looks like Rebecca said she can.
Rebecca, okay. Let me find you on here and unmute you. There we go. All right, Rebecca.
Muted. Can you hear me?
Yep.
Okay. I have been using the telehealth platforms. I've been using Doxy.me, and I use DocuSign. I created a consent form, and I'm more than happy to share that, as well as I put out a document for the Oklahoma members, and it has been very well received. Just kind of outlining how to start and how what to do. Lots of the platforms, the consent forms, and tips. I would say one of my best examples so far was I had a grandmother who ended up being the caregiver at home. I had consent by the parents to let us interact. And the little guy was very, very fussy, and I could tell the grandmother was very stressed, and so she went to get the AFOs, and she was obviously had not put them on many times. So we walked through that, and it was very neat because as the session evolved and we got a flow, everybody calmed, the grandmother calmed, and we were able to really get some very nice, I would say, therapeutic activities that the grandmother felt very good at. And at the end, the grandmother unsolicited said, that was very helpful. So I think you can touch so many different people this way. And I have had people use, several of my clients have been using cell phones, and that has worked. So I don't discourage people just have a cell phone. It has worked just fine. So I've had very, very positive experiences. I've had nobody said they did not want to do it, and all of them have wanted to continue. So I'm glad to share the documents too that I created, if that would be helpful. Thank you.
Thank you very much.
Rebecca. So Jason, there's a couple here. One of them is about a PTAs. I think, again, that's going to come from your state. Another person asked that they live in New York City, but is temporarily living in New Jersey, and I'm licensed in New Jersey. I think part of what the governor opened up in New Jersey is that you are allowed to treat across the border. I know in Pennsylvania, our governor opened that up as well. So I would check your New Jersey website, because I'm pretty sure that's what I saw. And that's what I've been told by a practice that was part of ours in New Jersey as well. So certainly check that on your governor, from my experience, has been really doing a great job of opening things up and really wanting to get the family served as best they can. But maybe someone has a different experience in New Jersey, but so far looking to me like it's been a great experience.
So there are a lot of resources that people are posting in here. So many that I can't really say. So what I'm going to do is at the very end, I'm going to save the chat, and then we'll make it available for you guys to be able to see.
Are there any school therapists? I know we have the 7 different districts for our school therapists, but I know I've had several questions about providing telehealth in school. If you join into the school SIG town halls over the next few days, two have taken care of already. I mean, 2 have already had, but there's 5 more to go. But if anybody from the school SIG is on and would like to share some of the things you're doing with the children in school that have now been left out, let us know.
Somebody asked, are you changing your IEPs to express the change in service delivery? And Michelle Wetzel said, we are not amending IEPs, only using Pro 1. I'm not a school therapist, so I'm not sure what Pro 1 is, but those who are, I'm hoping that makes sense to you.
Oh, and a while back, someone asked about doing evaluations for early intervention.
Somebody is amending IEPs.
There's been a lot of back and forth on the House of Delegates on the hub relative to that, having physical therapists, if it's ethical, unethical for us to do evaluations the first time. On telehealth, it's interesting. I know my opinion would be that I think that I want to do it in person, but I mean, it's going to go state by state how that is. I can tell you that our early intervention program, we just got an email this either yesterday or today saying that they're trying to figure out a way to do the initial evals prior to. So I'm a little bit worried about that, especially having to see the child then not for the first time in clinic. Perhaps if they did telehealth eval and then you're able to see them in person, I wouldn't be as worried, but I think we're going to have to take a deep breath and see what other people are doing. If anybody has been doing evaluations or has their other counties been, if you want to share your experience.
Patora, do you want to talk about your experience? Because you had written a little bit about yours before. Would you be interested in telling your story?
Who'd you ask, Jason?
Patora.
Okay. Oh, I see, yes. Oh, so they're revising their IFSP in Colorado. I think ours are staying the same for now.
Oh, no, I'll unmute you, Patora. Yeah, no, that's okay. I just wanted a confirmation that you were comfortable with sharing. your story. So let me find you here and unmute you. All right, Patori, you have the mic.
Okay. I've been using, I've been authorized to use telehealth for about 2 years now. So when this all started about 3 weeks ago, I really didn't have any break. I went right into telehealth and got the forms, consent forms out to families. It's been 90% positive, especially working in early intervention and especially with babies. It's been very empowering for families. It's a true coaching model. The 10% that's been maybe negative has been in situations when I work with a family who have like twins and then a 3-year-old at home and school-age kids. And even though the twins may be all over the place trying to do some coaching with the parent when she's trying to wrangle twins or take care of the 3-year-old who's crying, then it's a difficult situation. But for the most part, it's been, and I follow up every visit with a little form for the families that I send to their email that tell what the summary was of the visit and the strategies we worked on. So they have a visual to work on for the next week. And then we address that at the following visit as to what were their challenges or what were their successes. I always say successes first, and what were their challenges. So it really tells, I think it makes the families feel that they have something to work on during the week.
Very good, thank you. One of the things that I want you guys to consider too, because we will be saving this chat, is that if people have their name associated with it, the nice thing is that you can go into the APTA directory and maybe seek out those other people who are in your state in this chat and collaborate, or contact your local PALS member or state rep. What was prior to the state rep, PALS members. Does anybody else have let's see. How do we know if telehealth has to be added to the IEP prior to initiating it? Does anybody have an answer to that?
I think it's probably going to depend on your state or your school district. Would you say so, Maria?
Do we have a school, Maria, let me unmute you, then, because let me unmute you here. I can.
Am I unmuted?
Yes, you are.
Okay, yeah, I think it's going to vary state by state and district by district. So, and sometimes campus by campus. So I would first look for guidance from your local education agency or your school district. I would contact your state Department of Education, and then of course, your state professional association as well, as your licensing board, just to make sure all things are covered. But specifically in terms of, if things have to be amended, those sorts of things, it's really up to districts to make those decisions and then make sure that's being done consistently.
A question was asked by Meredith Ryder. I rejoined following the hack a little late. Can anyone give insight as to what codes are being billed? I'm practicing outpatient hospital-based pediatric. I'm also a hospital-based pediatric therapist, and I think it is, at least what I know so far, is it's specific to the insurance company. Like for instance, we have Blue Cross Blue Shield of Iowa, and they have expressly told us what is billable in telehealth, and they've expanded it for this time being for us to include common billable things like therapeutic exercise, therapeutic or neuromuscular reeducation. However, that's specific to Wellmark Blue Cross Blue Shield of Iowa. And so you're going to want to check with each provider to determine what is going to be the best, what options they're opening up for you. If anybody else has a better answer than that, feel free.
No, and I think some of the APTA resources that they've put out there have kind of what they're getting back from across the nation in terms of individual insurances and billing codes that have to be used, whether or not a modifier has to be used. So I think that's where, as pediatric therapists, we have to look, because APTA is probably getting this information much more quickly than even the academy is. So be sure to check out those resources, and they're updated literally on, I think, at least twice a day, but at least once a day. They're putting those updates for any modifiers that have to be used. And then some states limit, like I know Oklahoma's Medicaid agency has limited certain codes. And so you need all of that. Again, you need to check with the individual payers, as well as, again, the use of modifiers that might be required.
And Pamela Lang actually just posted what she is actually using for documentation to explain the documentation, why a face-to-face visit is not occurring at this time, and why they're performing a telehealth visit. So thank you, Pamela, for that. Do plan of cares need to be updated and signed by MD prior to initiation of teletherapy services? I have a feeling that's going to be specific to the insurance company.
Yeah, I think we actually had this questions somewhere else today, and I don't remember if it was one of the other town halls or if it was an email or where it came from. But basically, I think if you're in a state that requires a physician's prescription, or you need it for purposes, or whatever the reason that you have it, unless you specifically stated kind of the mode of treatment you were going to be using, as long as you have an order, then I don't think it's specific, or that you need to go back and get one. Now, I think it's a good idea probably to inform the physician that you're, because of the current pandemic, that you're moving in that direction. But again, if you already have something that's covering your service that does not specify face-to-face, or doesn't isn't real specific, then, if it's just a PT evaluate and treat, then I think you're covered. I don't think you have to go back to them. I do think, again, it's just out of showing a good faith effort that you can tell them that you are switching to this different mode, if you will, of providing physical therapy.
And Maria, someone actually added on the chat, and this is, we've done the same thing, to make sure when you write your note to say that you're doing it in this mode, and that the parent had consented verbally if they weren't able to do it over the paper. So that's just document is that we all know that. And then there was another question that if I think that compensatory services will need to happen in the school districts. And again, I think that's going to be school district by school district. What do you think, Maria?
Yeah, and that's where again, this is another thing. And I just, prior to getting on here, we got some updated information from the U.S. Department of Education in terms of what, providing supports for individuals with disabilities in the public school arena. And so I'm going to have to comb through that. I think, they're trying to say that some of that may be exempt, but bottom line is, if the school district is providing, online services for general ed students, then they have a responsibility to provide those same, services or to children with disabilities. So I think it's, what good faith efforts are we making to ensure equity of all students, and that we're just not now saying, oh, we're not going to worry about students with disabilities. We have to show the efforts that we're making to do that. Now, that does not mean that online or telepractice or whatever is right for all students. And I think we can't forget that in the process. If we feel like safety, health is in jeopardy by providing services in this manner, then that's where we have to make those clinical decisions ourselves, and not be pushed into situations where we're causing more harm than possibly good. So I don't want us to lose sight of, in an attempt to do good faith effort, we're leaving behind our clinical reasoning and rationale for why we're doing what we're doing.
So true, so true. John, John Greenwood, do you feel comfortable sharing your triage that you use at your hospital? If you don't want to do it tonight, maybe you'll share it online, or you'll maybe be sharing that tomorrow with Bertie and the NICU on.
John, I've unmuted you.
John still there?
Let's see. Oh, he's not there anymore.
So
Yeah.
John and Bertie.
All right.
Gatlin.
Can you hear me now?
Oh, yeah. Hey, John.
Yay.
Great. Thank you. Sorry, I had myself muted. So what I shared with Cindy was just a little bit about our clinical decision-making for urgent and high priority patients that we needed to see in the clinic. And what we're moving to now is moving towards a more a process for determining telehealth visits for those patients that may have regression or time-sensitive needs clinically. So it's a progress. It's something that we're certainly in the progress of developing. I don't think we have all the answers, but you know, hopefully by the end of this week, we'll have a little bit more clarity on that. And it's something that I'd be happy to share. Ellen Brennan and Maria Fregala Pinkham are working closely with our state to kind of get some final answers on both the billing implications for hospital billing, as well as some of our Clinical Practice Acts and regulations around it. So, but I'm happy to share the framework, although it's still a work in progress.
Thank you, John. And then John being on reminded me that John and I had a discussion as well. I think one of the things we should be looking at, either at the end of this, maybe during this pandemic, is to look and say, which one of our leaders did things right? John's hospital is doing a wonderful job. There's several other hospitals I've contacted. They're doing a fantastic job as far as taking care of their clients, their families, ensuring their safety and ensuring the best practice, as well as taking care of their employees. So I think it'd be wonderful if we could share. Same thing with universities. We can maybe collaborate with each other and really put together some resources that we can, when we come out to the other side, to show what was done well, what could be improved, and how we can go about changing that in the future. So you'll see more of that, and you'll probably hear more from that from John tomorrow as well. And then looks like we had a question from Wendy. What if a therapist doesn't feel comfortable using technology? Do they have to make an effort on, or some state reps state they shouldn't be forced, which makes sense when there are other options, but now with everything going online, will that be adjusted? I'm trying to, I don't think any therapist should be forced to do what they're uncomfortable with, because that's just, your families are certainly going to note that. If that's the question you're asking, go ahead, Maria. Jason, can you unmute Maria? Maybe.
Maria, I'm trying to unmute you. There we go. Now it's working.
Okay. Yeah, this is another thing that I think you have a responsibility to make sure that you're comfortable using the technology. So that should be the first thing. And I know a lot of people say, well, my employer or my district is really pushing me to do this, but I've never done it before. I'm not comfortable with it. So really then the question that you should not just move forward with it. You would need to look at, especially right now, is if you dig your heels in and say, I'm not comfortable with it, therefore I'm not doing it, that really doesn't show a good faith effort on your part to kind of be flexible in the face of the current pandemic. So what I would suggest doing rather is to say, what resources are available to me that I can utilize to increase my comfort level and my knowledge with using such technology. And then make sure that, and that could include that the district, the district or the employer that you're working for should provide or should assist in providing in some of those resources. Now, if you're a private practice, that's a whole nother, question is, again, what's the role of myself as a private practitioner or private practice owner, and making sure employees that I have are responsible for that. But again, I think we do have, in making a good faith effort to provide equitable services, we have to seek out training that is now available. And I know, and that's going to be therapist dependent in terms of what your comfort level is with technology, as well as maybe you've dabbled in it a little bit or you've used it personally, but you've not used it in a professional environment. Then the level of training or, that you may need is going to be different than somebody else. So that's going to be very therapist dependent.
I think a lot of individuals are like doing things together over Skype or over Zoom, well, maybe a more secure Zoom, and they're practicing together with each other before they try it out again. So I think those are some, you look for resources in your community to practice together. Maria, stay on, because I think the next question, one person, their clinic has closed. This is Heather. She's currently in her state. Telehealth isn't being supported by insurance companies, so the parents aren't getting services elsewhere. She'd like to provide pro bono. In addition to liability, she's wondering what other things she should consider to do that. Consent for sure.
Yeah. Oh, and I think that's where I'm not even sure I know the answer to that. I do know APTA has, and this was prior to the pandemic, has resources available if you're thinking about establishing a pro bono clinic. So I would look on the APTA website for that, and just, make sure that you've got all those factors covered.
And this is certainly a question that we could take to APTA too, Maria, and ask, and they might have some answers as well that we could share once we figure that out as well. That'd be great. I'm looking to the ones.
Somebody asked a question if we can consider doing a forum that is specific to COVID-19. And so that way for mentoring and people can post information on it. Yeah, I think we could. Maria, do you think that would be a good place for that?
Absolutely. I mean, that's where I initially started posting under the advocacy section, which is not kind of intuitive for people, but it was the quickest way for me to get information out. It was a consistent place that I could tell people to go to on the website to get that information out. So I think, yeah, if we want to start just one that says COVID-19, and that way when it's all said and done, we'll know it's old information, but it would give people an avenue to share resources and kind of some member-to-member contacts.
Jason, could you bring up the screen since you're sharing and show the area where we're talking about as far as our banner, and then also where the forums are?
Almost certainly. I actually just created the COVID-19 specific discussion. So, all right. So let me show you guys. So I'm actually in it right now, the forum, but let me go back to the main website.
Yeah, and Connie pointed out a good thing within the chat box is that a lot of this has already started happening within practice. So there's I don't know if there is it a subcategory, Connie, that's under there, or?
Yeah, there's one right here. So currently you guys can see my screen, right? Is that correct?
Yes.
Okay. So for everybody who's watching, this is the main website. You're going to need to log in using your APTA member login here. And then click the forums. It'll take you then to our forums. You'll see that anything that doesn't have a lock on it, because these are closed forums, but there's forums that you can have discussion in. And there is now a new forum that is COVID-19 specific discussion. I'll see if I can, the forum that was just discussed about is in pediatric physical therapy practice, right here, this forum. There is a discussion specific to COVID-19 that says, please post any resources, documents under this thread. What I may try to do is see if I can change this to go underneath the COVID-19 discussion category. So that way we can move it over there and have all the discussion in that COVID-19 specific discussion forum. Okay.
I don't know if the person, the young lady, I think it was Heather, that you said that you were, if you're uncomfortable with using technology, Joanna said that maybe if you could maybe post video ideas for the students to attempt, that might be one avenue to take. And yeah, that was one of the, I see also too about caregivers being present. That was one of the requirements we have on our, for our therapists as well, that the caregiver must be present for sure. I mean, if you're
Right.
a 15 or 16-year-old, it might not be as, they need to be in the
So,
home, but I don't know. What do you, if there's a, maybe, I don't know. What do you think, Maria? Is there an age limit to when the caregiver should or shouldn't be there?
Yeah, I mean, that to me goes back to, I don't know that it's any different than when you're providing treatment or intervention. And I know we're dealing with schools and parents aren't there, but I would use whatever the legal guidelines is in your state for, you know, age of minority, and use that as guidance. I mean, that's my off the top, haven't really thought about an answer, but I would think in most cases, you know, if you're not doing it when the parent is home and they're at a child care facility, or I don't know, I'm trying to think of other arenas right now. Pretty much everything's shut down in Oklahoma. So
Yeah, same.
I'm assuming they're going to be at home with their families, but if they're in any other, then I would make sure you have consent. I would make sure that the parent, I mean, that kind of goes into even HIPAA stuff, is who do you have releases for to be able to do some of this, the practice if the parent's not there. So.
And the other one, I saw another thing that talked about the reimbursement being low. Again, I think some of the states, just like New Jersey did, are saying that they're mandating the insurance companies to pay the same rate at this point during this pandemic. But and also, if you've tried to compare the e-visits to telehealth, the e-visit rate is definitely low. It's like, what is it, like $12 for 5 to 10 minutes, and then for 11 to 20, it was like I've read 18 already. Highest rate over 30 for greater than 21 minutes. And there's speculation whether or not you could do more than 1 7-day. I still haven't seen anything confirmed on that. I don't know if you have, Maria, that after that 1 7-day trial, can you do a second one?
Yeah, I
but
have.
that rate is pretty set across the country. That is very low. But I think if you can champion, again, contact your legislators, contact your pal in your group, contact Maria or one of us, and we'll help you to advocate for that. And hopefully maybe things will stay a little bit more stable once we're out of this too, that the insurance companies won't backpedal.
are there any other questions? Great. Barb said this session has been incredibly informative. Oh, will there be a link for the recording? Yes, what we will do is we will end up publishing this version of it. So this is a separate link, separate recording. We'll publish this so that way you can link to it and view it. I'll also copy the chat. I'll save it and I'll put it, this will all be in the news section. So under the news, which is on the front page, I'll create a link that will link to the video, and I'll also put the document that is the chat discussion there as well. Does everybody sound okay with that?
Okay, should we wrap it up then? I'll give some closing remarks here.
Yeah.
Well, again, I really appreciate all of you. I appreciate your patience with what we happened in the beginning of the session and hanging in there and calling back in. I know it took a while, but we have almost 6,000 members, and Cindy was really quick getting that new link sent out there, and we'll continue to sharpen our technology skills with our new Zoom platform. So we appreciate, again, your patience with that. Just again, we are all in this together as a profession, as a community, as a nation, and certainly as one world. And now more than ever, we know that our APTA President Sharon Dunn, her belief is that we are better together. It's imperative that that leads us through this uncharted territory. Dalai Lama says that under the greatest entity, there exists the greatest potential for doing good, both for oneself and for others. And I think every one of you has that capacity, and I'm totally confident that we as pediatric therapists and we as members of this fantastic academy will forge forward and do the best that we can for every one of the families that we serve. So thank you so much.
Thank you. The question was asked if I'm going to be hosting these town hall meetings, the other town hall meetings. Unfortunately, I will not be able to be at all of the town hall meetings, just from a standpoint of I have a day job.
But I do believe that every one of the town halls has someone assigned that will be the host as well. There'll be a very similar format, and myself and the board plan to be on as many as we possibly can. Thank you all
Thank you
for
guys for attending. Thank you for your understanding for our complications at the beginning.
Bye, everybody. Have a great night, and everybody be safe.